Welcome to the Sports Desk. Now, the PSL finished last season in a bio-bubble, and thankfully there were no infections reported. They then took the decision not to implement the same measures for the start of the current season. Joining us now to talk to us about all things football and COVID-19 is South African Football Association Chief Medical Officer, Dr. Thulani Ngwenya. Dr. Ngwenya, good evening and welcome to Sport on the Full View.
Good evening, Vusiwe, and good evening to all your viewers. Thank you for having me.
Now, Dr. Ngwenya, you oversaw and continue to oversee the compliance with COVID-19 protocols. Tell us, what are some of the stresses that come with this responsibility?
This is a huge responsibility. The biggest stressor is that the buck does not only stop with the compliance officer. You need even the other role players and the players also, the actual athletes, to actually do what you're actually requesting them to do. So that then comes with a huge responsibility. I'm the main overseer, but then there's teams, each club has their own overseer, and that then makes it a bit okay to actually try and deal with this compliance matter. But otherwise, it is a huge responsibility. Without the players actually helping you in making sure that they are adhering to the regulations put in place, then it becomes very impossible to do this.
So let's say, for example, there's an encounter coming up. What would that then involve in terms of you and your discussions with the various teams to ensure that those protocols are adhered to?
Okay, an encounter in terms of the match?
Yes.
Okay. In terms of the match coming up, if you remember very well, what we did previously to finish the previous season was a biological safe environment where everyone was playing in a bubble. But right now, because the bubble is not sustainable because of how expensive it is, we have said that now we can play home and away, especially because we're at level 1 and government has opened up the economy. So we are still also adhering to stringent measures that are in place. For instance, if there's a game that is going to take place in Cape Town, each team is still supposed to have a compliance officer, and each team, where before the start of everything, each team was supposed to actually test their players and make sure that they are all negative. And then on a daily basis, they are actually screened for symptoms, not only the temperature screening, but they are actually screened for all the COVID-19 symptoms. Over and above that, they have to always have their mask on, not unless they are training or playing. And they also have to observe the social distancing, which is 1.5 meters apart. That is why when you see them sitting on the bench, they are no longer sitting on the technical bench. It's only the technical and support staff sitting on the bench, but the rest of them are sitting on the stands there. And as you notice, there are no fans allowed in the stadium because we are trying to control the environment, and we are trying to make sure that there's a minimal people to be at the stadium as possible, so that we can be able to play this lovely sport of ours. And mind you, this is a contact sport, so meaning that there's more risk because there's contact. That is why we need to control the environment as possible.
Yes. Now, would you say that the challenge for you is now greater, given that you're not in a bio-bubble environment versus where there was a bio-bubble? It was so much easier to manage everything.
Correct. Yeah, well, right now, especially that now there's a resurgence of the virus, it is actually even more difficult. But what is good is that, and what we're actually getting comfort from is that our players, the continuous education that we give our athletes is actually helping because, to be honest, most of them are adhering to the rules and regulations that we have put in place. Because without that, then we'll have more players testing positive and would not have a game. Because if you have more players testing positive, unfortunately, then there can't be any game. So it is difficult, yes, to control the environment, but we are really relying more on the players. It's really out of our control because now when they play, they go back to their family, they go back to their friends. So it becomes very, very difficult to control. But continuous education is what is actually happening on a daily basis now.
Okay, let's just broaden our discussion a little bit. Sports like rugby and cricket have been very transparent in terms of the results that they've gotten when they've tested players, and they've had to cancel and sometimes postpone some of those encounters. How is football getting it right when we've seen with both cricket and rugby that they're not always getting it right and obviously having to then postpone or cancel?
In terms of getting it right, I can't really discuss much because I don't know what happened in rugby and in cricket. But like I said before, it takes a collective effort. Everyone needs to be a role player. It doesn't have to be the compliance officer always monitoring. This continuous education, this rigorous and frequent testing has to be the order of the day. And again, like I said, it doesn't take one person. It takes the whole team. All the players, all the technical and support staff to come and be role players, because should one of us then test positive, then it affects the whole system. So it takes a collective effort. Maybe what I can say in football, what we did right is this continuous education, this rigorous and frequent testing that we have done, and also making sure that people understand the consequences of having a positive case in a match or in a team, because then it affects the whole system. So I think what we did right is this continuous education.
As you're just speaking about the consequences now, for someone who's sitting at home and they don't really know what these consequences are we just cancelling all the games? Do we now have to go and track who came into contact with various players? What are those consequences, and what would then happen if you were to have positive results that come through following an encounter?
The consequences are huge. Let me speak, for instance, with CAF, because I'm also a CAF medical officer. When you're having a team, right now we're busy with the CAF games, Champions League games. There was a team that had positive players, players that tested positive, and they had to lose the game, and they lost the game with 2 goals against them and 3 points against them. That is huge. That is massive. So CAF says that a team needs 11 players on the field and 4 players on the bench. If you've got more players than that, if you can't have 3 players sitting on the bench and 11 on the field, unfortunately you lose the game. So that's a huge consequence. Then it comes with so much responsibility. Then that is why players then understand that if then that happens, the whole team loses. And it's so unfortunate that you would lose on a Champions League sport because of a player that tested positive. That is why we do this continuous education and then tell them of the consequences. And the consequences, then they understand very well, because then it has serious consequence to the team and to the funding of the team, because you win Champions League, you get so much funding.
Yeah. Okay, so now Kaizer Chiefs allowed reporters into the stadium in their encounter last night. Is this an indication perhaps of things to come in the league, and is it perhaps a bit concerning given that we are now in the second wave of COVID-19?
I didn't get the question. Kaizer Chiefs did what?
Allowed reporters into the stadium in the encounter last night. Is this an indication of where we're perhaps heading as a league? We're probably going to allow supporters to start coming through. And is this a concern for you from a safety perspective, given that we are now in the second wave?
Yeah, well, the first part, because I was also compliance officer of that game, the people that were allowed into the stadium had to test for COVID-19. And all those that were in Zone 1 and Zone 2 were tested, and they provided us with the results. Only those that were in Zone 3 and Zone 4 were only screened, not tested. But in terms of allowing people back to the stadium, I don't see it happening now, especially because now we are having the second wave. And safety is very important and paramount. And health of our people is very important and paramount. Yet at the same time, we need to balance with the livelihood. Because if we allow more people to come in, it will compromise safety. And without a healthy player and a player that is, without a player that is not negative, or rather having more players that are positive, then it means that there's no income for that team and that player. So we want to balance the two, and safety is the order of day, and safety comes first before the livelihood.
Thank you so much, Dr. Thulani Ngwenya, for talking us tonight. Have a good evening further.
Thank you very much.
There we go. That is Dr. Thulani Ngwenya, the Chief Medical Officer at the South African Football Association. That's unfortunately all we have time for in this bulletin.